channel. So today is the day that I'm getting my implant. I'm so nervous. I gotta drill a hole in my gums. So nervous. Anyway, so first I have 3 appointments. First, I'm on my way to my orthodontist because they have to take off my bracket at the bottom so that the surgeon can drill, you know, in this space right here. So once they take off the bracket, which takes no time, then I have to zip over to the surgeon and have that process, and then go back to the orthodontist so they can put my bracket back on. So I'm so nervous. I was not able to eat or drink anything, okay? So already that sucks because I'm hungry. And hopefully, she gonna be high. So like, okay, when I went to the consultation, they told me it's painless. They said, because I asked them about the pain and stuff, and they said it's very painless, don't worry. But I'm like, how if you're drilling a hole and putting a screw in my gum? So I don't know, and I really hate when they have to put the numbing stuff, you know, the needle in your gums, and then I hate all of that. I hate getting anything done to my teeth because that stuff hurts. So I don't know how this is gonna go. I'm so, but I'm assuming it's not gonna take that long because I have my second orthodontist appointment when I gotta go back to get the brackets on. It's at 11:30 and my appointment is at 9:15. So I guess it shouldn't take that long for them to do this, but I don't know. It's just, oh God. And I'm wondering. And then tomorrow, so we have my stepdad's birthday, and I'm hoping I can eat. So I'm hoping this is not one of those things where I have to sip through a straw, because I don't want to be doing that. So I don't know. We'll see. I'm gonna ask tons of questions. I don't know if I can get footage. It'd be great if I could, but I don't know. You know, some places don't allow you to do that. So we'll see. But for right now, I am going to my ortho. My ortho appointment is at 8:30, but then they said that they sent me a message saying that my surgeon appointment or whatever is, well, check-in is at 8:45. I'm like, how that's gonna be? Because, so we'll see. I'll be there before 9:15, I know that. But yeah, so pray for me. Lord have mercy, it's gonna be a lot. But see, look at that, oh my God. And then I had gum graft when I was back in Chicago. So that's why my gums look lighter in the front, because they took some of my gum from the top root of my mouth and put it at the bottom because my tissue was very scarce, whatever, however you say it. So yeah, that's why it looks really light and kind of off, but whatever. I'm getting everything done. That's the most important. I'm getting everything done, getting my mouth fixed. I mean, veneers just probably would have been easier, but you know, whatever. This glare, it's so bright. Anyway, so I'll check back in when I'm on my way to my ortho. No, when I'm on my way to my surgeon. I will check back in. Okay, guys, so I just got out of my ortho. These are some big houses. Look at that. I don't know what it is.
Turn left on the Preston Road.
Almost big. By our house?
No, by my house.
Oh yeah, they got those pretty fast. Okay, so I just got out of the orthodontist. They took off my bottom bracket here, so it's just the, I'm sorry, they took out the bottom wire. Okay, so my bad. So they took out my wire at the bottom, right? So I just have what they call is the bracket. That's what's stuck to your teeth, the silver part. So the wire that goes across that, you know, brings them together, they took that out so that the surgeon can do what he needs to do. But she also put what they call a chain on the top of my teeth. So she took out the wire of that. And no, actually, I think she kept the wire. And it felt like a rubber band that she was looping. And she put it on there to pretty much close any small gaps that I have at the top. And she said I am going to be a little tender, but I already feel it, like my head and my nose. It just feels like it was a rubber band that was tightened, and it just is pulling my teeth. I'll be glad when all this crap is over, okay? But I'm now on my way to my surgeon to get that portion done. And yeah, so I hope they let me film, not film because I really don't want to be sitting there holding a camera, but I at least want to get a thumbnail in the chair. But we'll see. I hope they let me eat afterwards, but she said I'm a little sore. I don't know, just we'll see. Okay, so I'm here at my surgeon appointment. I'm whispering because I'm in the bathroom. I just signed out my paperwork and I'm about to go into the waiting room and get my surgery done. Okay, here I go. I'm in here waiting. They just took a bunch of x-rays, so they're gonna put me to sleep. I didn't know that, so I'm excited because I gotta feel no pain. So I'm still in here waiting. We'll see. Pray for me, y'all.
Am I supposed to zoom? The slow-mo, yeah. I just zoomed in. You look crazy. You look like you really been through it.
He started surgery, so either him or we have a nurse that works here. They'll call you tonight.
Okay.
See how you're doing.
Okay. Awesome. Thank you so much.
In the whole room,
Uh-huh.
and they gave me back. They put all the stuff on me, and it has tape on me, and this is the whole thing. I want to check you that. I have you laid out on the table, holding up. I think I had laughing gas. I don't know, laughing at
yeah, I guess it was a full-blown surgery.
I don't think it took that long because I think I went after like at 11. What time is it?
It was a little bit before 10 when you said that they were taking you back. And it's like 11. This is 5 minutes, so it's like 11:20. Actually, you have to go because I think your appointment is at 11:30.
So okay, so yeah, it was a lot. I'll explain when I'm pulling out.
She high? You feel high?
I don't feel high. I just feel like
loopy.
Yeah.
Okay. Okay. She says bye.
Hey guys, so as you guys can see, I am back at home. I am still a little woozy from the medication, not the medication, with the sleeping gas and all that stuff. But once all this wears off and I'm well rested, I will explain, you know, from the beginning when I got there to coming home. Right now I'm about to eat because I'm so hungry. I've not eaten anything at all. So I'm so hungry. I'm gonna eat, get some rest. Okay, this is the most exciting thing, is that I get to rest and do nothing but just catch up on my shows. I hope I'm not blocking. I hope I was not blocking the sound. I still have to figure out where the sound is on this thing. I don't know, but if I was blocking the sound, pretty much I'm back at home. And I will explain everything from when I came in to I came back home. You know, how it was and how the setup and everything was. But I'm still drowsy and woozy from the laughing gas or whatever they gave me. I was not aware that I was gonna have to go to sleep, which is amazing because I thought they were gonna have to numb me through sticking the needle in my gum, which I would have hated. So I'm actually super glad I went to sleep. But yeah, so I'm hungry. I'm about to rest and do nothing and watch TV and just stay in the bed all day, which I love. I don't know if you guys can really see. This is what it looks like. it's yeah, it's pretty gross. It's pretty gross. So yeah, anyway, I'm about to lay down. I'm tired and my food is getting cold, but I will absolutely finish this a little bit later. Hey guys, all right, so it is the next day, the next morning, and I wanted to come on and kind of wrap everything up of what happened yesterday. I am no longer under the laughing gas or the sleeping medication, and the numbness has went, you know, completely down in a way. So I'm now coherent, if that's the proper word or term, to talk about everything and kind of just sum everything up, and also put in some little details that I may have missed or didn't think to talk about. But now I will, because I posted a picture yesterday on my social media and there were a couple people that were interested in the pain, you know, and just things like that. So I thought to just put in some more details as far as even how much it costs, you know, and, you know, all that good stuff. So yeah, so here we are, and I want to go step by step as to exactly what happened yesterday and see where we are now. So as I told you guys, and as you guys can see in the video, I started off with going to my orthodontist. I had 3 appointments. I had to go to my orthodontist first, the oral surgeon second, and then go back to the orthodontist. Now, I do have videos prior to me getting the braces, before and after, the reason why, and just kind of went on over details of why I need the braces and how long it's going to take and all that good stuff. So go ahead and check those videos out so that you can know exactly what's going on and how we got to this point. I actually was supposed to have this surgery done the end of July, but I pushed it back, and then I got COVID, so I had to keep pushing it back. And so now we are here, and it finally happened, which I am so glad this is over with, financially and anxiety wise, because I was just like wondering. I wasn't nervous or scared, but I was just anxious, like, is it gonna hurt, right? And the funny part, and don't judge me, was I wanted to know whether I was gonna be able to eat or not. I told you guys that, right? So we'll get into all of that. So yesterday I had an 8:30 appointment with my orthodontist, right? So I had to get my wire taken out. So the silver part that you see that's stuck onto the tooth, right? The silver, actual silver little part things is called a bracket, right? And then the wire, if you see right here, that's what's called the wire, that it loops through all of the brackets, you know, to hold the teeth together. So they had to take the wire out so that the surgeon can, you know, get in and do what he needed to do. They took out the 2 brackets here in the back of my teeth. I don't know why they took it out. I think they said the oral surgeon wanted them to be taken out, but I didn't understand why, and it sounded like neither did my ortho understand why, because my implant was right here, so they didn't even have to be right here. I don't know, but anyway, they just left it out. So, but it's giving me a weird feeling, and this, because these brackets are sharp, and so it's, this end part here is like really snagging on my gums and stuff, so it's very uncomfortable. So I don't know why they left these 2 brackets off, but it's really starting to bug me and get on my nerves. And then also, if you guys are wondering, which I did mention before, I had a gum graft, so this is why my gums here look lighter than the rest of my gums, because they took parts, or took, you know, pieces or whatever from the root of my gum, not my nose, or from the root of my gum, and put it down here, because I think my gum tissue or whatever was getting thin or something like that at the bottom. So they had to do all that stuff. But that happened back in Illinois, so that was like maybe 3 years or so ago. So yeah, so that's that. Now, went to my ortho. They took the wire out. They also put in what they call as a chain at the top of my teeth. So I have a wire at the top of my teeth, right? But then there's what they call as a chain, which to me, I didn't see what it looked like, but it felt like a metal rubber band. And they were just kind of looping it through my teeth at the top, through the brackets, to kind of tighten any spaces that were left. What seems to be like the finishing touches to the braces. So any any spacing that I had, like small spacings that I still had left, that I guess that chain, what they call, was going to kind of close it, right? So she said you were going to feel uncomfortable, but it wasn't painful. It just really was uncomfortable, because as soon as she put it on and I walked out, I felt all this pressure within my nose, within my forehead, the back of my forehead. Like, it just, you can really feel something pushing your teeth together, right? So, but that wore off, I want to say, within like an hour. So it was okay, but it was just like, oh, I was not expecting them to do that either. But whatever. So I was done with the ortho. We went over to the oral surgeon, right? So we got there, signed some paperwork. Pricing, okay? Now listen. First and foremost, let me just say this. None of my insurance covered any of my braces or this surgery. So your girl absolutely came out of pocket with all of this. I don't know how. Because literally I spent like about a good $9,000, maybe plus. $9,000 and some change on these braces and procedures. I don't know where I got that money where I got that money from, because I look back and I'm like, when did I have that much? But yeah, I guess hard work pays off, because your girl was absolutely, I told y'all, I work my butt off. I'm a workaholic. I do OT out the butt. So that's, I guess, is how I was able to do it, because I don't know. But anyway, the oral surgery. So my dentist, I'm sorry, my insurance, and I have good insurance. It's just, you know, when you're a certain age, they don't cover a lot. And I'm 35, so they're not gonna cover a lot of stuff. So let me give you the rundown. Okay, so the total procedure, right, without any insurance, any discounts or anything like that, was $4,851, okay? $4,851. They said an estimate insurance, meaning my insurance only covered and gave $60. $60.80. Then it says insurance adjustment was $906. And estimate patient balance, which was me, that I was responsible for, was $3,884. Now, I don't know what that really means as far as insurance adjustment. I mean, yes, it does sound like that the insurance covered, you know, $900. So let's see, $906 plus $60. But from my understanding, they told me that pretty much insurance don't cover things like this, but they'll try. And so I never heard anything back as far as, oh, okay, your insurance covered this, but I guess they did. I don't know. Okay, so $906 plus $60.80, which is $966.80 that I guess the insurance covered. To me, the way that the surgery, the people at the surgery, you know, oral surgeon office, the way they explained it to me was your insurance pretty much is not going to cover anything, right? So I guess they did. I don't know if they did or whoever did. Thank you. So I was only responsible for $3,884.20. So at the time of your booking, which is at the time that you schedule your appointment, you have to put down a $500 deposit, right? So I paid $500 up front. Mind you, they don't do payment plans. So there was no like payment plan or like, okay, let's do a monthly thing. It was none of that. It was none of that. It was we need all your coins in one day. Like my oral, my ortho, like I had a monthly plan with them before I end up just paying the remainder out, which was like $2,000. But I was on a payment plan with them, so it was cool. But here, the ortho, they was like, oh no ma'am, like we're not doing, you can apply for care credit if you want, but that's about it. Like, we need all our money up front. So I was like, oh, okay. So I had to pay $3,884 yesterday. So I was just like, oh God, like I gotta give you the whole thing, like not half of it, like not just a piece, a couple dollars here and there, you know. No, she said, no girl, we want the whole thing. So yeah, that was that. So signed some paperwork, you know, paid their remaining balance, boom. Then went in there into the dental office, and the lady, now this lady, she was really, really nice. She was with me the whole entire time. She was really, really nice, really supportive, all that good stuff. So I went into the office and the room or whatever, and I went into the, you know, dental room or whatever, you know, whatever, because there's actually a separate room they took me to do the actual surgery. So that's, you know, why I'm trying to make it a difference. But I went to the regular, you know, dental room with the chair and stuff like that. And so the girl, she did like a 3D imagery of my teeth or whatever. And so it was pretty much like a long toothbrush type of form. But it was like, it had like a little camera type of thing on it and a lens or whatever. But it was like a square lens. And it was taking images. It was a 3D image of my teeth. She showed me on the computer, you know, and she was just all up and through, like all up and through. And so basically how she explained it to me was the doctor, instead of him pinpointing like by eye where to put the screw or whatever, they do it by computer. So where it kind of tells him where to put it type of, it's a whole technical thing. Listen, it was crazy. So I was like, oh, okay, cool. So then we were talking or whatever, because I asked her, I said, okay, so how bad is the pain? She's like, oh, it's not gonna be painful at all. She was like, you are gonna be put to sleep, right? And I'm like, I don't know. Now, I'm thinking I'm coming in and getting the good old-fashioned needle to numb me and stuff, you know, how they normally do dental work. No, ma'am. They put me to sleep. When I found that out, I was like, oh, okay, cool. Like, you know, do what y'all do. I was cool. Like I said, I wasn't scared initially, but I was very anxious to see how this is gonna go. And I was also worried about me eating. Like, I really wanted to eat afterwards. So I was just like, I really, really did not want to go through having to put the needle in or anything like that. I didn't want to do that. So I was just, when she said you're going to be put to sleep, girl, you ain't saying nothing but a word. So I was like, okay, cool. So she told me that it depend on how strong my gums were, whether it would just take 2 or 3 weeks or so to keep this in, or a couple of months, or if I had to like come back or whatever. And so she told me later on, I'll show you a clip of after I got out, and she was giving me the directions and stuff like that, and that I didn't have to come back because I guess my gums were strong enough. But anyway, so like, okay, cool. So then we, you know, she took the pictures, she took more x-rays or whatever, we're chilling. She did like this whole molding thing to my teeth and all this other stuff. So boom, that took about a good, I want to say 30-35 minutes, right? So then it's time to go to, you know, the surgery room and get it done. Now in my mind, I'm thinking that I'm just going to be in a regular dentist office with, you know, in the dental chair, you know, just, you know, the small little dental room where they do all their work, whatever. No, ma'am. We was like in an actual surgery room. Like, I thought I was about to go get another C-section the way it was set up. I was not expecting any of that. And I was like, oh, they walked me back there. And it was like, listen, ladies, if you ever had a C-section, you know what I'm talking about. You go into that cold room, they have all this space or whatever. They have all the gadgets and gadgets. They had the anesthesiologist there, and, you know, they patching me up and wiring me up and stuff. And they put the laughing gas on, and she put the IV or whatever in my arm. And I was like, okay, this is a whole product. Like, I had the whole, you know, gown or whatever. I didn't take my clothes off, but I had like the whole, you know, that plastic or whatever thing they cover you with or whatever. And it made sense because they'll send you a text message of the instructions, right? You can't eat or drink anything, not even water, 6 hours prior. And so they also tell you to make sure you wear a t-shirt with short sleeves, a shirt with short sleeves, long pants, and closed-toe shoes. And I'm like, listen, why are you trying to tell me how to dress? Like, I don't understand. Am I about to be cut open? And I understand, I see why now, is because, you know, we're going into the surgery room. But I had no clue as to why they were telling me to dress that way. And now it made sense. But then I was still thinking, like, I'm just getting a tooth implant. Like, are you guys taking me under the knife? Like, what? I just was not expecting that whole setup. I really wasn't. But I guess surgery is surgery, so it is what it is. But so it was kind of crazy because the medicine and stuff started kicking in, so I started to become like a little loopy or whatever, and I was still able to hear and everything else, but I was like getting more relaxed. It was a little loopy or whatever, and then the doctor comes in. And so the doctor comes in, right? And he's like, oh, hey, Simone, da-da-da-da, right? And so this is the second time he told me this information, right? He says, and I can't remember whether he said it's common in African-American women or it's not common in African-American women when it comes down to our gums or something like that. And it was a word he called it. It was a long word. I couldn't remember it then, and I can't remember it now. But he said it to me again. I was just like, okay. So he said it's not, he didn't say it was anything to be cautious about, but he said we're just gonna be delicate. And I'm like, okay. And so now the lady prior that was doing my images and stuff, she was like, because I asked her how long does it take, and she said the actual procedure takes about maybe an hour, but for me, since I want to be asleep, it may seem like 5 minutes. So I'm like, oh, okay, cool. So we go in there, and I remember him coming in, I remember him talking to me, I remember him telling me about the whole African-American women thing. And then I remember him saying, okay, Simone, take deep breaths, take deep breaths. And I'm taking deep breaths, and he was like, okay, Simone, take deep breaths, make sure you're taking, and I'm like, I felt myself, like, sir, I'm breathing. What are you talking about? I was just like, I don't know. It was just crazy, but I don't remember him ever touching this side of my tooth. And I'm just like, I remember him coming in, I remember talking to him, and then I remember him saying, all right, you did a great job. So it's like, and I guess, like, I don't remember falling asleep. So I'm like, and I do not remember anything of him being on this side, ever. I don't even remember him touching my mouth. I don't even remember him touching my mouth. So I guess that was some good stuff, because I don't even remember that part. And it really did seem like 5 minutes. It was painless. Listen. Great job, because your girl was just, it was perfect. So I wake up or whatever, and I was, of course, they got me together, whatever, put my shoes and stuff back on. I don't know why my shoes was off. I think because I do remember him saying something about, I don't know if they were trying to put something on my nail, like to calculate, what is your blood pressure? It's, you know, the little things they put on your fingers, like to calculate your blood pressure or your blood or something like that. I don't know. But I do remember him saying something about we have to tell ladies up front about people wearing nails, because I guess they couldn't get something on my nail, on my finger. I guess they couldn't get something on my finger because of my nail, so they had to put it on my toe. So I briefly remember that. Here. But anyway, so that was kind of interesting. So the lady got me up or whatever, right? And of course, you know, I couldn't really walk straight because I'm, you know, a little loopy. And so now I'm actually going to enter the video of when I came out, when she sat me down and she was giving me the direction and everything. And you can just kind of see I was a little out of it or whatever. And it looked like you would think I had head surgery with the little thing they had on. So here's a clip of what happened after I got out and the instructions of what the lady was telling me to do as part of my medication.
Alright, so in here it's an ice jelly.
Okay.
And it's inside. There's another one inside. She's probably gonna have to hold it, you know, like that, because it wraps around your head. And we put the implant right there. Okay. So, but there's another ice jelly in there. Okay. A small toothbrush. This is Pearl Sinus Gel. This is really important. Just 4 times a day. You can read all this too, but 4 times a day, put a drop on a finger or a Q-tip and just rub it on that gum area. Oh, okay. It'll help it heal. Okay. Thanks for you. Thank you. I send over to her pharmacy amoxicillin and Tylenol 3. The amoxicillin is an antibiotic. I gave her some of her IV, so don't give her any today.
Okay.
And tomorrow, you're going to do that for a week, breakfast, lunch, and dinner.
Okay. So she starts her medications tomorrow.
Just the amoxicillin.
Just amoxicillin, okay.
The Tylenol 3 is for pain. I would start that today.
Okay.
She's going to be numb for a few hours. So I would get home, eat something, and then take the Tylenol 3.
Okay.
If she doesn't need the strong Tylenol 3, I would get over-the-counter ibuprofen because that will help with pain and swelling.
Okay.
So what I would do is I would eat something, give her 3 tabs of over-the-counter ibuprofen, and then see how she does, and then give her some more 6 hours. If there's no pain, then you don't need the Tylenol 3. If she complains about pain, then give her the Tylenol 3.
Okay. Okay.
She has stitches. They dissolve, but they take a while. They take like sometimes 3 to 4 weeks.
Okay.
Where they do dissolve. We were able to, she had enough bone. I know, remember you were asking me if you had that, how long. So we don't have to do that second part. Well, we don't have to do, so you just have 2 parts today and then 1 more part. So she'll come back in 2 weeks. We'll just see how she's been healing.
Okay.
And then she'll probably come back in like 2 months, and then we'll loosen that healing abutment. I'll show you. Open for me.
Oh.
So she has a healing button right there.
Okay.
And I'm going to put a new one in there.
Okay.
But basically, we'll undo it, see how she's feeling, and then she can go to her dentist and get the tooth.
Okay. Oh, my goodness. How you feeling, eh?
So you're going to change the gauze every hour for 4 hours.
Every hour, 4 hours?
Yeah.
Okay.
And I just like to, it doesn't have to be perfect, but I just like to have a cushion. And then bite. So this one's long, but it's okay.
So how is she going to she has to go get her wire back on. Are they going to be able to work around that?
Oh, yeah.
Okay.
Bite it in. Okay. So yeah, change that every hour for 4 hours.
Okay.
Yeah, they can put this back on. They can do it either today or tomorrow. And, you know.
Okay.
But yeah, everything was good. I'm going to see if Dr. Shillingburg can say bye to you.
Well, thank you so much. Maybe the question. Do you feel like weird? I don't know what you're saying. Okay. Let me stop, because actually my thing is upside down.
Okay, so as you guys can see, I was a little out of it, okay? But the nurse, that's the nurse that was with me the whole time. She was really, not a nurse, dental assistant. She was really, really nice. But she, you know, was telling me everything and what I needed to do. That was my sister who was recording. She was with me. That was another thing. They made it mandatory. You have to have someone 18 and older with you to drive you and to stay in the building at all times. And so she was giving me directions of what I needed to do and my medication and stuff like that. So as you guys can see, what she mentioned, the kind of medication she gave me. But it is I don't know how to say this, acetaminophen, I don't know. Of course, it's down here below. Amoxicillin, and which I gotta, no, the monotelica, I don't know how to say this stuff. Anyway, it's all on the screen and you guys can hear it in the video. I think it's the monotelicas, well, I don't know. I have to even watch, I gotta watch the video again myself to remember what she said to take the next day, which is today. And I think it's that Mone something I gotta take today. No, it says at bedtime. I don't know, I have to see which one I gotta start taking today. But anyway, and then she also gave me this here, which is that Parascience or something like that she was talking about too. I don't know if you guys can see it or not. I don't know. Oh, there we go. I guess that does work, huh? Anyway, so yeah, so I have to start taking those things. But so after a while, the numbness went, you know, wore off last night. Still, there was no pain. For me, it was no pain. It was more soreness. I do have stitches, as you guys can hear. She said I do have stitches. But it's still, like right now, I don't feel any pain. I don't feel any soreness now, actually. None on this side at all. None. So that's great. That's amazing. I'm so glad I don't have any. I hope that continues to where I don't have any pain. And the soreness, you know, can stay away or whatever. I do feel swelling. Of course, I do feel the stitches, but like I really don't feel any pain. I'm not uncomfortable right now, any of that. I do have to come back in 2 weeks for a follow-up, and then as you guys hear, she said that my dentist will be the one, because I was confused at first as to who put the actual tooth in, and it's my dentist. So that's a conversation me and my dentist is going to have. But yeah, that's pretty much it. I just came home. I took I think I took one of the pills and I went to sleep. I needed some rest. I ate some, let's see, I ate, she said you can eat macaroni, like soft things, macaroni, mashed potatoes, noodles, or whatever. So I had some macaroni from Chick-fil-A. Chick-fil-A macaroni is bomb. Let's just throw it out there. Anyway, and I had some of their fries, their waffle fries at McDonald's. I'm sorry, at Chick-fil-A. And then you can't drink through a straw. So which I like to drink through a straw. I have one of those like metal straws. So it was just kind of weird drinking out of a cup or whatever. And now like it's morning time and I want to make me an iced coffee, and I can't drink out of a cup. So it's like, ugh. But anyway, they don't want you drinking out of a cup. Oh, here's a little pamphlet thing that they do give you here of instructions. And so it pretty much, you know, it says implant post-op activities, what you can do. They recommend you can resume to normal activities, including working, school. Normal activities including working in school. Heavy lifting and extreme exercise should be avoided for a few days. Discomfort, take pain medication as prescribed. Bone grafting, if in case of a bone graft, you may notice some of the bone particulate work its way out the socket. Okay. Oh, oral hygiene, it says oral hygiene is extremely important. Resume brushing and flossing the evening of your procedure to careful. Resume brushing and flossing the evening of your procedure. Be careful to avoid surgical sites, though, for 2 weeks. Use the Parascience gel, which is this, 4 times a day to keep the implant site clean and healthy. After 2 weeks, you may resume brushing the implant as you would your normal teeth. Avoid smoking. So I did not use this morning because I thought, I read this, but I kind of like rushed through, you know, it. So I didn't really pay attention to what I was reading. I just kind of, you know, browsed through it. But I thought it was saying not to brush on this side. So I brushed my teeth this morning, but I just didn't brush right here. But it's saying that I need to use this on this side. So I'm gonna go back when I'm done with, you know, this video. I'm gonna go back and brush my teeth with this. You should resume eating and drinking right away. Follow a soft diet to start, but advance as tolerated. Be careful to avoid biting or chewing directly on the implant. So I bite on my right side anyway, so I was not using this side at all. So that was no problem for me to chew on this side. This is extremely important, especially if there is a healing cap peeking out of the tissue. Pressure on the implant during the first few months after surgery is the #1 cause of implant failure. So yeah, you just pretty much got to be careful and just don't go overboard with stuff and doing crazy stuff, because you have an open wound and you know, you got some things going on, so just be careful. But anyway, that is that. It's pretty much nothing else to, you know, talk about or to continue on as far as recording with this. It's you know, well, I mean, of course I'm gonna give you guys updates as I vlog, you know, my regular life or whatever. Of course, when I do get the actual implant of the tooth from my dentist, I'll, you know, vlog that and go into detail. But as far as just getting the implant, the oral surgeon is pretty much done with what he needs to do. So my next steps overall in the procedures is just to get my braces taken off. I'm supposed to get my braces taken off in 2 months, less than 2 months, October. So I'm super excited about that, and I hope that's still, you know, going according to plan. Yes. So I'm getting my braces taken off, and then my implant. And that's pretty much the final steps. So of course, again, I'm going to be vlogging all that good stuff. I'm super excited for this whole process to be over with. I'm just ready to get my mouth back to normal, to get back to eating. Like, I didn't realize how much this affects me eating. And I just feel like I can't eat my food right. I can't chew right. I'm always worried about, you know, the food going into my because it's already kind of hard, you know, flossing. And I use the picks, the brush picks or whatever, to clean, you know, in between my teeth. And so I don't really chew down on my food because I don't want to get my food stuck into my braces and stuff. So it's been Amara. Anyway, so yeah, that's pretty much it. I can't wait till this is all done. I feel like I just can't eat properly. What paper? No, I have not.
It's the pink.
Oh, okay.
Mommy, where's that paper? I can't find it.
But yeah, so hopefully by October, September, well, it's not gonna be over in September, October, September. That's when I get my braces off. But I would say, of course, by the end of this year, I would absolutely be finished with everything. The very final last step, I think, is getting my teeth whitened. And my sister, Black Girl Makes, is my sister. She is actually a dentist. So we were talking about it yesterday, and she was telling me to get my teeth whitened first and then get my implant. So those are pretty much like the last final steps. So I'm excited that in a couple months this will all be over with. I have spent a lot of money on my teeth. I was not expecting all of this when I came in to just close my gaps. You guys seen that my bottom was just, I had a big gap. I was just not, and then the tooth was kind of big, higher than the other. I didn't like to talk, you know, in the camera like that. I did it, but I didn't do a lot of close-up talking, or even on my social medias, because I just did not like the way my bottom tooth looked. And so even with this, like talking with a missing tooth, it's just like, you know, but you can see obviously I have braces, so you see there's a reason why I'm just not walking around with no bottom tooth. But I would just be glad when all of this is over, because it will really, I don't want to say increase my confidence, you know, but I just feel like I know I can do a lot more within the camera face to face when this is all done. And just make, you know, other different kind of videos that I've been wanting to make but just haven't because of this. So I'm excited for this to be over with. I'm excited for you guys to see, and I'm going to vlog and, you know, take you guys on this journey as much as I can, in case anybody's, you know, interested and, you know, things like that. But like I said before, I think on my last video or so, I came to Texas with goals, and one of my goals was to fix my mouth. The very beginning thought was I wanted to get veneers to just cover all this up, but we went this route. And so nevertheless, I'm glad. It was a lot of money, but it is what it is. But the most important part is that I'm checking off the things that I wanted to do while I was here. And so that's the more accomplishing, happy moment for me. So yeah, thank you guys so much for watching. I appreciate you guys. I hope I was able to answer any questions you guys had. If you want to know any more questions, just comment down below or whatever and let me know, and I'll do my best to answer them down below. If you have any more questions, did I say that right? I don't know. But yeah, if you have any more questions and things that I did not cover, please comment down below and I will answer those for you. I got this done in Texas, and let me see. Flower Mound, okay, so Flower Mound, Texas. The doctor is Dr. Shillingburg, which I will put all his information down below. Of course, this stuff is not sponsored or anything like that. I haven't gotten on that level yet, but she will get there. But no, I mean, I just feel like any, you know, business or whatever that I feel is good, that I liked or whatever, you know, I'll put the information in case you maybe, I don't know who's in Texas who follows me or whatever. So if you are in Texas, if you are in that area, you know, hey. But yeah. So anyway, that's all I have for you guys. I appreciate you guys coming back to our channel. Please continue to watch, like, and subscribe, and turn on your post notifications. My child.
Oh, I do it. Mommy, can you help me?
Help you with what?
Can you help me?
Do what? Why are you playing with the tape?
I just get my condiment.
Children don't care nothing about you being sore, being hurt, being in pain. They care nothing. Let me tell you a small little story. Yesterday, I was asleep. My child comes in, my son comes in after school. It's his second day in school. He comes in telling me, sleep, mind you. I took some medication. Your girl just had surgery. I'm sleeping. Comes in, Mom, you gotta sign this for football, and you gotta sign this for this, and I need it. Cares nothing that I had surgery. Cares nothing that your mom is sleeping tired. Cares nothing that she is sore right now. She just had surgery. She's feeling a little woozy. Cares nothing, right? Kids are so selfish. Anyway, thank you guys so much. We appreciate you guys. We'll catch you on another video. Amar's about to have a fit.